Radiotherapy can cause side effects in the area of your body that is being treated. You may also get general side effects. Side effects usually appear gradually during your course of treatment and may continue for a period after your treatment has finished.
Short-term side effects, if I talk about initially, normally come on about halfway through treatment. So if you think of it in the first half of treatment, whether the first 2 or 3 weeks, normally the side effects are fairly minimal or may not have any side effects at all. And those side effects are usually entirely local to the treatment that we give.
You will be given advice about managing side effects. The advice may include not smoking, avoiding alcohol, eating well to maintain a healthy weight, drinking plenty of fluids, and trying to keep as active as you can. Here are some of the most common side effects following radiotherapy for head and neck cancer.
Often patients will get some degree of a skin reaction, and that's similar to really almost like a sunburn. Basically the skin can go red, and most of the time we can use radiotherapy based creams that help minimise that, and it's almost like an after sun. It's a kind of a moisturiser type cream. And in some patients where we think the reaction is more of an issue, we can also use sort of cooling dressings.
Wash your skin gently with mild unperfumed soap and lukewarm water and pat your skin dry. Only use soaps, creams and lotions that your radiotherapy team recommend. Avoid wet shaving as your skin will be very delicate. Try to wear loose cotton clothing as this is less likely to irritate sore skin. Protect your skin from the sun by covering up with a hat or loose scarf around your neck. And always use sun protection as skin is more sensitive to the sun after radiotherapy.
So you get this redness, and potentially then you can have sore throat, altered taste sometimes of the food, maybe not taste as well. You sometimes have a reduced appetite. You can get more secretions than you normally do, almost like, you know, when people have got a cough, sometimes they bring up thickened phlegm. And you also then, as a result of that, it's all a sort of cycle of similar symptoms. You can have difficulty swallowing or difficulty having as much calorie intake as you normally do, which is where we really rely on the support of our speech and swallowing therapists that would see you, as well as our dietitian, to help decide on how we can support you in that phase of treatment.
Brush your teeth or dentures with a small soft toothbrush for 2 minutes, only on a morning and on an evening. We recommend patients use a fluoride mouthwash after each meal, and your radiotherapy team may have a certain mouthwash they will recommend for you.
Radiotherapy treatment that's based around the voice box here would certainly cause often some potential change to the voice if you haven't already got it associated with, you know, how maybe you got picked up with a cancer diagnosis in the first place. But it can cause, particularly with the dryness of the mouth, the secretions, you know, straining of your voice, maybe hoarseness of voice, and maybe your voice maybe not as powerful or as strong as it usually is. And that's all to do really with the, I guess, the reaction that's happening during the head and neck cancer treatment. But again, we would have to see how that would respond once you'd sort of completed your treatment, and often these side effects, when the inflammation settles, you would hopefully be able to see some improvement afterwards.
Try to rest your voice. Avoid smoky atmospheres, and a speech and language therapist will be able to give you advice.
When you come through for your treatment initially during the network, you will have been assessed initially by a dentist, or certainly a dentist will have looked at often a dental x-ray of your teeth. And that's important because during head and neck cancer treatment, when you have, after treatment, you sometimes end up with a drier mouth, you don't produce as much saliva, and that has a protective dental effect. So a worry longer term with people that have had head and neck cancer treatment is that you potentially could have more susceptibility to dental infections. And people that have got dental infections or dental problems, they may not heal as well as if you had somebody that had went through head and neck cancer treatment. And these sort of side effects tend to last for the second half of treatment, and then would usually potentially even be a little bit more troublesome for the first few weeks after you finish, before hopefully gradually starting to improve week on week. And normally about 6 weeks after people finish head and neck cancer treatment, they normally feel much better than where they did when it was at its most difficult.
Late effects may include a dry mouth, a higher risk of tooth decay, difficulty swallowing, stiffness in the jaw, neck or shoulders, and swelling in the head and neck area. Your radiotherapy team will explain what to expect and give you advice on managing your side effects. Always tell them about your side effects. There are usually things we can do to help.
All our staff, we feel are very friendly, approachable. We anticipate and also We entirely appreciate that these are very difficult times during people's lives. We'll have contact numbers normally in association with a clinical nurse specialist where you can leave a message anytime and we'll get back to you, and we'll hopefully be able to help you with any queries that you have.
Please visit the Northern Radiotherapy Network website if you have any questions or queries.